Have you ever felt that knot in your stomach before a big
Oh,
presentation?
yeah, definitely.
Or maybe that buzzing, nervous excitement just before a first date? We toss around the word anxiety for these everyday things,
We
right?
do all the time.
But what's really striking, I think, is how anxiety means something totally different, much heavier when we're talking about clinical anxiety disorder.
Absolutely. It's a whole different level, far beyond just nerves.
Yeah, it's like we're diving into something much more complex here.
Precisely. And that casual use, it can sometimes overshadow the real distress, the, life-altering impact these clinical disorders have. It's a crucial distinction.
And that is our mission today. We're doing a deep dive into More Than Stress, Understanding Anxiety Disorders
Mm.
by Cherry Pedrick, Bruce Hyman, and Tabitha Moriarty.
Mm-hmm.
The goal here is to get past those casual definitions, pull out the key insights, what clinical anxiety really is, all its different forms, what's behind it, and importantly, how people can actually manage it.
Mm.
Think of this as like your shortcut to really getting informed on a topic that honestly touches so many people.
It really does. And the book itself, it's dedicated to the millions who struggle, their families, the professionals, working so hard.
That's great.
And while it's written very accessibly, even for teens, like 11 to 18,
Okay.
the insights are valuable for absolutely anyone who wants to understand anxiety better.
Okay, so let's unpack this core idea first. Fear versus anxiety. We use them interchangeably sometimes, but the source makes a really key distinction. Fear. That's the basic, fast response to a clear danger right now.
Yeah, your brain's alarm system, survival instinct.
Exactly.
And it's proportionate. It makes you study or, block your door. Luana Marquez at Harvard Med School, she puts it well, worry is a way for your brain to handle problems in order to keep you safe. It's supposed to be functional.
Okay, functional. So that's fear. What happens when it crosses the line? How does the source define clinical anxiety then?
Well, that's described as an excessive response,
No.
often out of proportion.
Out of proportion. How so?
It's usually focused on a hypothetical future danger, something that might not even be real or is years away.
Okay. Like the example they give, right? A 9-year-old worrying intensely about their driver's test.
Exactly. Their heart's pounding like the test is tomorrow, but it's a decade off. The perceived threat is distant or maybe not even clearly defined.
Wow. So how does this anxiety actually show up?
Mm-hmm.
The source breaks it down, doesn't it? It's
Yeah.
not just one feeling.
Not at all. It's really a full body, full mind experience. The book highlights how it hits you on 4 levels: physical, mental, emotional, and behavioral. Someone might feel one intensely or, a mix.
Right. Okay, so first, the physical stuff. That's the racing heart, maybe.
Mm-hmm. Rapid heart rate, that stomach discomfort, butterflies, people call it trembling, nausea, muscles getting tight, sweating,
Yeah.
even vomiting or diarrhea, shortness of breath sometimes.
Okay, and mentally, what's going on in the head?
Just a general sense of uneasiness, lots of worry, intrusive thoughts popping up, maybe confusion, trouble concentrating, feeling helpless.
And emotionally.
That can be feelings of panic, intense embarrassment, or fearing rejection.
Got it. And the last one, behavioral.
That's where you see avoidance. People start avoiding certain things or places or situations that trigger the anxiety.
Okay.
Or, like in OCD, performing rituals, these repetitive actions to try and relieve the distress.
So it really disrupts everything.
It does, a holistic disruption.
So when these things become constant, what's actually happening in the brain? The source talks about a false alarm system, right?
Exactly. It's basically your body's natural fight or flight response getting triggered inappropriately, overactivated.
Like the system's too sensitive.
Sort of. Your brain's threat centers the amygdala, the anterior cingulate cortex, the locus coeruleus. They start pumping out adrenaline even when there isn't any real present danger.
Like a faulty smoke detector going off constantly.
That's a great analogy. The book uses a shark example.
Oh, yeah.
Healthy fear is seeing a real shark in the water. Your heart races, you swim faster, that's appropriate.
Right. Makes sense.
But someone with clinical anxiety might have that exact same intense get away now reaction just looking at a picture of a shark.
Or even just thinking about one, maybe.
Potentially, yes. It's a false alarm. The threat isn't real, but the body reacts as if it is.
And these false alarms, they don't just happen once, do they? It sounds like the brain kind of learns this overreaction.
It can, yes. The pathways get reinforced. It's like paving a highway for that anxious response. So what might start as temporary jitters can become a really ingrained anxiety disorder, a cycle.
That paints a really clear picture of the experience.
Mm.
But, okay, understanding it is one thing. What causes it? Why do some people develop these disorders? That's the next big question, right?
It is, and the source is very clear. There's usually no single cause. It's rarely that simple. It's
Good.
almost always a complex mix. Biological factors, genetics, psychological aspects, your environment, they all interact. Each person's vulnerability is unique, like putting together a puzzle with different pieces.
And it's pretty common, isn't it? The statistics are kind of alarming.
They really are. The National Institute of Mental Health data, it's stark. 19.1% of U.S. adults in a given year. That's almost 1 in 5.
Wow.
And 31.1%, nearly a third, will experience an anxiety disorder at some point in their lifetime.
That's huge. It's not some rare thing.
Mhm.
It's really widespread.
Absolutely. It highlights how much we need understanding and support. It's a major public health issue.
So let's talk about those contributing factors, genetics. So you mentioned
Yes. Research suggests some people might inherit a sort of extra-sensitive fight-or-flight system, like they're just wired to be more alert, more nervous from the start.
like being born worried.
Something like that. And studies on identical twins really back this up. They're much more likely to both have an anxiety disorder compared to fraternal twins, which points to that genetic link.
But it's not just genetics, right?
Mm.
That's important too. Environment plays a big role.
Huge role. Things like your upbringing, ongoing stress, early experiences you couldn't control, family illness, a death, other traumas, they can definitely increase vulnerability. Well, the book gives an example. Parents who are intensely focused on illness, always worried about getting sick, their kids might grow up hyper-focused on their own bodily sensations, potentially predisposing them to health anxiety later on.
Ah, I see. So early learning patterns.
Exactly. And many people find that a major life stressor often comes right before their first panic attack.
Like what kind of stressors?
Illness, death of someone close, divorce, losing a job, even moving house. Big changes. Therapist Claire Bidwell-Smith is quoted saying, "When some big change comes and disrupts life, we realize we're not safe. We're not in control. That feeds anxiety."
That makes sense. Feeling out of control.
Right. And it's not always one big thing. Sometimes it's the buildup of smaller chronic stressors that finally tips the scale.
Okay. So genetics, environment, life events.
Mm.
What else? Are there biological factors beyond genetics?
Yes. Neurochemical imbalances in the brain are often implicated, and also certain physical health conditions. Things like heart or lung problems, hormone issues, even low blood sugar can trigger or worsen anxiety symptoms. And substances too, caffeine, nicotine, alcohol withdrawal, they can all play a part. It's this intricate mind-body connection.
It really is a complex web. Okay,
Yeah.
so we have a general picture. Let's get more specific. The book dives into particular disorders using the official diagnostic guide, right? The DSM-5.
Correct. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition from 2013. That's the standard clinicians use.
Got it. So let's start with panic disorder. Affects about, what, 4.7% of people?
Around that, yes. And it has two main parts. First, you have recurrent unexpected panic attacks. These are short bursts of really intense fear.
Unexpected is key there.
Yes. And second, there's this persistent worry for a month or more about having another attack or worrying about what the attacks mean, like, am I losing control or am I dying?
That sounds terrifying. What does a full attack feel like?
It's overwhelming. Racing heart, feeling like you can't breathe, chest pain, dizziness, maybe feeling detached or unreal, and often that intense fear of dying or going crazy.
And they can just happen anywhere.
Anywhere, anytime. And the book stresses experiencing them doesn't mean someone is weak. It's about that internal alarm system going haywire.
That's a really important point. And this often connects to agoraphobia, right?
It often does, yeah. Agoraphobia affects about 1% of the population. The name comes from Greek, fear of the marketplace.
So fear of open spaces.
Not just open spaces, it's more about avoiding situations where escape might be hard, or where help wouldn't be available if a panic attack did happen.
Okay, so avoiding crowds, elevators, maybe even leaving the house.
Exactly. Sometimes people rely heavily on a safe person to go places, or they carry safety objects like medication or a cell phone just in case. It gets described as fear of fear, being afraid of the panic symptoms themselves.
Wow. Okay, moving on. Social phobia, or social anxiety disorder. This one's quite common, 12.1%, mostly starting in adolescence.
That's right. And it's much more than just being shy. It's severe anxiety in social situations because of a deep fear of being judged, scrutinized, embarrassed, or humiliated.
And it really gets in the way of life.
Significantly. Things like public speaking, dating, meeting new people, even just eating in front of others can cause intense distress and avoidance.
What causes that? Is it learned?
It can be a mix. Genetics seem to play a part, environment too, like having very critical parents or maybe just being naturally shy. And there's brain research too. A Duke study back in '94 found differences in a brain area called the putamen, which makes dopamine.
Hmm.
So neurotransmitter imbalances might be involved.
Interesting, that mind-body connection again. And this ties into something newer the book mentions, social media anxiety disorder. It's not official yet.
Not in the DSM-5, no,
Yeah.
but it's increasingly recognized. It shares features with social phobia, but the trigger is specifically social media use.
Okay, so what does that look like?
Things like constantly checking feeds, comparing yourself negatively to those, perfect curated images online.
Yeah, we all do that a bit, maybe.
Right, but this is obsessive. Linking your self-worth directly to likes and followers, feeling intense anxiety about negative comments or being ignored online.
And that has real consequences.
Definitely. It can fuel body image problems, crater self-esteem, make people feel more isolated. The U.S. Surgeon General even warned about social media's impact on youth mental health back in 2021.
It's important to say, though, right? Social media itself isn't the enemy. It's the way someone uses it when it becomes problematic and distressing.
Exactly. It's the relationship with the platform.
Okay. And then there are specific phobias, affecting around 8.7%.
Yes. This is that excessive, totally unreasonable fear of one specific thing, an object, or a situation, and it leads to active avoidance.
And the list is endless, right? Spiders, heights, enclosed spaces.
Needles, flying dogs, clowns, even, as the book notes, triskaidekaphobia, fear of the number 13.
Huh. Okay. So these aren't just dislikes. They're intense fears tied to one specific trigger.
Exactly, a very targeted false alarm.
Yeah.
And they can develop through genetics, watching a parent be afraid of something, or sometimes after a specific traumatic event involving that thing.
Makes sense. Okay, so those are some specific types. But anxiety can be broader, too. The trigger's less defined. Let's talk about obsessive-compulsive disorder, OCD. Affects about 2.3%. Often starts young.
Correct. And the key here is understanding the two core components, obsessions and compulsions.
Right. Obsessions are the thoughts.
Yes. Persistent, unwanted, intrusive thoughts, images, or urges that cause a lot of distress. They just barge into your mind.
And compulsions are the actions.
Right. Repetitive behaviors or mental acts that the person feels driven to perform to try and reduce the anxiety caused by the obsession or to prevent some feared outcome.
Like checking locks over and over, or excessive hand-washing.
Classic examples. But sometimes the link isn't logical. The source mentions arranging books perfectly to prevent harm coming to a loved one. And there are mental compulsions too, counting, silently repeating phrases, reviewing events mentally. Or scrupulosity, where people have intense religious or moral obsessions and feel compelled to pray constantly or confess minor perceived sins.
That sounds exhausting. What's behind OCD?
Again, a mix. A
Yeah.
genetic predisposition, definitely. Serotonin imbalance is often implicated. Brain imaging shows differences in certain circuits, like involving the orbitofrontal cortex.
Okay.
And interestingly, the book mentions a link between childhood strep throat infections and sudden onset OCD in some kids called pandas. The antibodies seem to attack the brain.
Really? Strep throat.
Yeah. And also, traumatic brain injury or childhood trauma can be factors.
And related to OCD, there's trichotillomania.
Yes, briefly mentioned. Compulsive hair pulling leading to noticeable hair loss. It falls under that obsessive-compulsive related disorders umbrella.
Okay. Then there's post-traumatic stress disorder, PTSD. This follows a specific trauma.
Yes, exposure to an event involving actual or threatened death, serious injury, or violence.
And the symptoms are distinct.
Very. There's persistent re-experiencing flashbacks, nightmares. There's avoidance of reminders and emotional numbing, feeling detached, unable to feel positive emotions, maybe seeing the future as bleak. And there's increased arousal, being jumpy, irritable, having trouble sleeping, always feeling on guard.
And it affects veterans significantly, but also others. The book mentions higher rates in Black Americans.
Yes, prevalence is high among veterans, 11–20% for Iraq-Afghanistan vets. And research does show higher rates among Black Americans compared to other racial groups, likely linked to factors like historical trauma and ongoing systemic stressors.
That's a really important dimension. Okay, one more broad one. Generalized anxiety disorder, GAD, affects about 5.7%.
Right, and the defining feature here is excessive, uncontrollable worry.
Worry about what?
About lots of different things. Future events, finances, health, family, work, often things that have little realistic chance of happening or where the worry is way out of proportion.
It's constant.
Pretty much. Most days for at least 6 months, that's the diagnostic criterion.
So how is this different from just regular worrying? We all worry sometimes.
That's a key distinction the book makes. Normal worry might help you plan or solve a problem. GAD worry is pervasive, feels impossible to control, doesn't lead to solutions, and is often really incapacitating. It's like this constant background hum of dread.
I see. And it often comes with other issues, like depression.
Very often. Up to 90% of people with GAD also experience clinical depression. And physical symptoms are common too. Headaches, muscle aches, stomach problems like IBS.
And the causes sound familiar.
They do. Genetics, family stress, trauma, neurotransmitter imbalances, similar themes we've seen across the board.
Okay, so we've mapped out quite a landscape of disorders here. It can sound overwhelming. What's the message for someone who recognizes themselves or a loved one in this?
The absolute bottom line is get help. Treatment is crucial. Untreated anxiety disorders often get worse, and they can spiral into other serious problems like depression or substance abuse.
So first step is getting a diagnosis.
Absolutely. From a qualified mental health professional, a psychiatrist or psychologist, you need that accurate assessment to know what you're dealing with.
How do you find someone?
Your family doctor is a good starting point. School counselors can help. National organizations like the Anxiety and Depression Association of America have provider directories.
Okay.
And the source really emphasizes finding the right fit. That relationship between you and the therapist is key. You need someone you trust, someone who understands your background, maybe specific cultural factors or LGBTQIA+ issues, if relevant.
Makes sense. That connection is vital. What about treatments? The book talks about therapy, right? CBT.
Yes, cognitive behavioral therapy, CBT, is highlighted as highly effective. It's very practical, focused on the present.
Not digging deep into the past, necessarily.
Less so than some other therapies. CBT focuses on identifying and changing the unhealthy thought patterns and behaviors that are happening now and maintaining the anxiety. It's like getting a toolkit.
Okay, what's in the toolkit?
Well, there are cognitive strategies, helping you challenge those faulty beliefs or automatic negative thoughts.
Like the what-if spirals.
Yeah.
I have a headache. What if it's a tumor?
Exactly. Those catastrophic thoughts. CBT helps you examine the evidence, question the irrationality. It's not about forcing yourself to think positively. It's about thinking more accurately. Replacing dysfunctional beliefs with functional ones. You learn to manage your thoughts.
Giving you back some control.
Precisely. And then there are the behavioral strategies. A big one is exposure and response prevention, or ERP.
Exposure. That sounds scary.
It can be, definitely. It works on the principle of habituation.
Habituation.
Yeah, like putting your foot in cold water. At first, it's shocking, uncomfortable. But if you keep it there, your body adapts, habituates, and it feels less intense.
Okay. So how does that apply to anxiety?
With exposure therapy, you gradually, systematically confront the things you fear, situations, objects, even internal sensations like a racing heart.
You make your heart race on purpose.
Under guidance, yes. For someone with panic disorder, they might run in place to trigger palpitations, learning they can tolerate the sensation without it escalating into full panic.
Wow. And for OCD?
ERP for OCD means confronting the obsession, like touching something perceived as contaminated, but then preventing the compulsive response, like not washing your hands immediately. You learn the anxiety eventually decreases on its own without the ritual.
It sounds really hard.
It is hard work. And for PTSD, exposure might involve carefully recounting the traumatic memory, imaginative exposure, or gradually re-entering situations that trigger reminders, all while reframing thoughts about safety and control. It really needs professional guidance.
Absolutely. Okay, so therapy is key. What about medication? The book covers that too.
Yes. Medications can be very helpful in balancing brain chemistry. We talked about neurotransmitters, serotonin, norepinephrine, GABA being like chemical messengers. Imbalances can disrupt things.
Right, so meds help fix the balance.
That's the idea. SSRIs, selective serotonin reuptake inhibitors, are very common. Things like Prozac, Zoloft. They increase the available serotonin, which often helps reduce both anxiety and depression symptoms.
Okay. Are there others?
Benzodiazepines like Valium or Xanax work on GABA. They offer fast, short-term relief, which can be useful in a crisis, but they can be habit-forming, so they need careful medical supervision.
Right. Caution needed there.
Definitely. And beta blockers are sometimes used. They mainly reduce the physical symptoms like a pounding heart, useful for things like performance anxiety or stage fright.
So meds aren't a cure-all, but part of the picture.
Often, yes. The best outcomes usually come from combining medication with therapy, and it's crucial never to stop medication abruptly without talking to your doctor because of potential withdrawal effects or relapse.
Good advice. Okay, beyond the clinical stuff, the source talks about broader well-being, right?
Yeah.
Stress management.
Absolutely. Holistic health is vital, and it touches on important points like research showing higher rates and severity of anxiety in Black and Hispanic communities, possibly linked to chronic stress from things like institutional racism.
Which again highlights the need for culturally aware treatment.
Exactly. Understanding the person's whole context, their lived reality.
And the book also notes how often anxiety and depression overlap.
Yes, they frequently go hand in hand, so it's good to be aware of depression symptoms too. Loss of interest, persistent sadness, fatigue, changes in appetite or sleep.
Okay. And there's a crisis hotline mentioned.
Yes, the Substance Abuse and Mental Health Services Administration, SAMHSA. Their national helpline is 800-662-4357, a really important resource if someone's in immediate distress.
Good to know. So for everyday life, what can you, the listener, do to manage stress and build resilience? The source has practical tips.
Loads of them. First, understanding stress itself. It's defined as a strain from demands. But crucially, stress is often about your perception of events, not just the events themselves.
So how you see things matters.
Immensely. And there's good stress, eustress, like excitement for a challenge, and bad stress, distress.
So how do you manage the distress?
Mindset reframing is huge. Taking deep breaths, noticing negative thoughts without getting swept away, and actively trying to reframe situations. See them as challenges, maybe find humor. It's hard to feel stressed while laughing.
Easier said than done sometimes.
It takes practice, but one concrete technique is scheduling worry time.
Worry time, like booking an appointment with your worries.
Kind of. Set aside 10-30 minutes each day specifically to worry. If a worry pops up outside that time, acknowledge it and tell yourself, okay, I'll deal with that during worry time. It helps contain it.
I love that idea. Compartmentalizing. What else?
Building support systems, talking to trusted friends, family, other adults. Connection helps. Also, getting organized, making lists, breaking big tasks down. It gives you a sense of control.
Yeah, feeling overwhelmed is a big trigger.
Exactly. Setting small, achievable goals builds confidence, too. And basic problem solving for worries, you can control, list options, take action.
What about just relaxing?
Essential. Engaging in hobbies, music, reading, and practicing specific relaxation techniques. The book mentions the relaxation response described by Herbert Benson. Abdominal breathing is a simple, powerful one.
Eat belly breaths.
Yes. Slow, deep breaths stimulate the vagus nerve, which helps calm your nervous system.
And general body care. Diet, exercise.
Super important. A balanced diet, lean protein, complex carbs, healthy fats. Avoiding too much caffeine, nicotine, other stimulants that can ramp up anxiety.
Paid exercise.
Definitely. It's like positive stress, eustress. Releases endorphins, gets oxygen flowing. Doesn't have to be intense, 20-30 minutes, 4 or 5 times a week. Even walking helps move that anxious energy.
Yeah.
And don't forget rest. Consistent sleep is crucial. Having a relaxing bedtime routine, taking breaks during the day, longer vacations when possible. And laughter, the book calls it an ultimate stress reliever. Changes perspective, connects us.
It really covers a lot. So bringing it all together, what's the main takeaway? If you're listening and struggling or know someone who is,
The main message is absolutely one of hope. A diagnosis isn't a life sentence. It really isn't.
yeah,
With the right approach, therapy, maybe medication, lifestyle changes, usually a combination, people can and absolutely do get better and live full, healthy lives.
and even if you don't have a clinical disorder, these stress management skills are useful for everyone.
Invaluable. We
Yeah.
all face stress. Learning these coping strategies benefits everyone.
And it feels like people are talking about this more openly now.
Definitely. There's a growing movement. You see celebrities, Selena Gomez, John Green, Ariana Grande sharing their own struggles with anxiety, OCD, PTSD.
Yeah, that makes a difference.
It really does. Athletes, too, like Marcus Morris talking about using antidepressants. When people with platforms speak out, it chips away at the stigma, encourages others to seek help. It normalizes it.
It makes it less isolating.
Exactly.
So a final thought to leave our listeners with, something to chew on.
Well, maybe this. Taking the time to really understand how your own mind and body work, especially around stress and anxiety, and then actively using practices to support your mental well-being, That's actually a really powerful act. It's self-discovery, it's building resilience.
Like taking charge of your own internal world.
Precisely. We've sort of offered a map here with this deep dive, but the real journey is integrating this knowledge, adapting these tools to your own life. It's an ongoing process, but one that can empower you to face challenges with, much greater insight and control.